All right, well, why don't we go ahead and get started? My name is Katie Frederick, and I am the Digital Content Manager for VisionAware, which is part of the APH Connect Center. And today we are going to hear from Kim Ladd, who has presented to us in the past, and she's a great presenter, and she's going to share some information with us about managing diabetes. But before we get to that, we have a couple of housekeeping issues that we want to share. So again, we will be putting things in the chat, so stay tuned for that. And we do have ACV REP credits for this. So we will go ahead and pause the recording and give that opening credit for those who are seeking ACV REP. All right, so Kim, I want to welcome you back with us today. And as I said, you've given us some great presentations around diabetes, which are available on our website as archived presentations. But we're here today to talk about managing resources for managing your diabetes. So I will let you take it away, please.
All right, sounds great. Thanks everyone for joining us. I apologize that my light is a little dim, so I hope the things that I show you, you're able to see. But let's get started. So like Katie said, I want to talk about some resources for managing medications for anyone that has a vision impairment. Most of these things I'm going to talk about are free, and I'll give a little demo of the products as well. So the first one that I want to discuss is the ScriptTalk system. So I'll tell you a little bit about it and demonstrate it, and then I'll tell you how to get it. So ScriptTalk, it's going to come in a box that says ScriptTalk on it. And it comes with a CD for instructions, as well as a booklet with large print instructions on it. And basically what it is, it's a speaker box. It's shaped like a half moon. It's about the size of, I'm trying to think of what it's the size of. It's smaller now. I have an older unit. So actually the newer units are smaller and probably like the size of like a CD player from the 80s, if you're familiar with that. Basically what it is, it has bump dots on the face of it. And then on the bottom of the face, it has 3 buttons. It has an up arrow button. The middle button is a oblong button with a bump dot on it. And then it has a down arrow button. If you don't remember any of the buttons, just remember that oblong one that has the bump dot, because that's the one that allows you to read the prescription bottles. The other 2 help with the speed of the voice, making it faster or slower, or fast forwarding through the bottle that you're listening to. The other control on it is on the side. So if I'm holding it flat on the table, it is the side facing me in the curved edge. It's like a dial button. So I'm going to go ahead and turn this machine on and let you listen to how it works.
ScriptTalk station ready.
So it prompts you that it's ready. You turn it on from that dial button. That is the volume button and the power button. So what happens is you get your medications from the pharmacy and they're going to put a special sticker on it. It's an RFID sticker, which is radio frequency ID, that works with this machine. They usually put it on the bottom of the prescription bottle. So when you get your prescription, you want to place it near those bump dots that's on the face of the machine. And then that oblong button that I talked about, that's the read button. That's the button that you want to push. So I'm going to place the bottle on it and then push the button and let you hear what kind of information this system will give you.
Patient John J. Smith. Medication amoxicillin 250 milligram capsule. Instructions: take 1 capsule 3 times daily. Quantity 30 capsules. Prescription date April 20th, 2017. Use by April 20th, 2018. Refills remaining. 1. Prescriber. Dr. Ben Casey. Scriptability Pharmacy. To reorder this prescription, dial 800-555-1212. Prescription number 1, 2, 3, 4, 5, 6. Warning. Important, finish of this medication, unless otherwise directed by prescriber. Warning. This medicine may be taken with or without food. Warning. May cause diarrhea during treatment. If it persists or becomes severe, tell your doctor or pharmacist. Warning. Persistent diarrhea due to colitis may rarely occur weeks or months after using antibiotics. If this occurs, notify your doctor or pharmacist promptly. For more info, dial area code 309-585-1563. Enter code 3295.
All right, so as you can tell, I hope that was clear to hear. Basically, what it's going to do is, the pharmacy's inputting all of that information into this RFID sticker for each medication. So basically, it's going to tell you the name of the medication, the strength of the medication, the directions for taking it. So, take 1 time a day or 2 times a day, the prescribing doctor. It also gives you the pharmacy prescription number, the phone number to call for a refill, as well as it said warning. If you couldn't tell, this medication causes diarrhea because it said it 3 times. But a lot of times when you get prescriptions, the pharmacist put these little stickers on your bottles, and it's about warning, like don't operate heavy machinery when you're taking this medicine, or may cause sleepiness, or don't take alcohol. Basically, all of that information should get relayed into that sticker. So you'll have all of the warnings that a sighted person would have from their prescription. So I love this machine. It is, in my experience and helping clients get it, they're very happy with it as well. Identifying medications is very, very important. There are so many medication errors that occur from taking the wrong medication or taking too much or too little, things like that. So anything you can do to make it safer, is better for your health overall. The number one thing that I get, when I help clients with vision impairments manage their medications, I always ask them, how are you identifying your medications? And the number one answer I get is by the shape of the pill. And that just gives me pause, because the shape of the pills can change, and a lot of pills are shaped the same. So it's really a stab in the dark when you're identifying them by their shape, if you're guessing correctly. If you have a brand name medication, the shape is not going to change. Or if you're able to see colors, and it might be like, I have a pill that's a very bright pink square, and that's a brand name pill. So that color and shape is not going to change because it's a brand name. But one day when the generic version comes out, my pharmacy might give me the generic of it, and it's going to be a completely different shape and a completely different color. So that theory of using the color or the shape to identify medications is not a safe way of doing it. So that is why I tell everyone that I can that has low vision or either illiteracy, if someone can't read, this is a great product for them to get. Now, there was a question in the chat about how much is this? So this is a free system. How it works is, Envision America is the name of the company that developed this technology. They marketed it to pharmacies, and pharmacies pay Envision America for the software and the printing and the right to use this to provide it free to their patients. So why not get it? It's not going to cost you anything. There is a catch. You have to go to a participating pharmacy. So I'll talk about that in a few minutes. I first wanted to go through everything with this system though. So this is the basic speaker box that you can get. It will not work unless you have the stickers, the RFID stickers, put on your medicine from the pharmacy. There is another way you can do this though. If you don't like the speaker box, or you want another way, there is an app. So ScriptTalk has an app that you can download onto your phone, and you can scan your RFID sticker with the app. So there's a short video that they made about it that I'm going to play, and that explains that. So just give me 1 second to share my screen. and get the correct video here. Here we go.
In this video, how to use the free ScriptTalk mobile app to speak the information contained on your medication labels. ScriptTalk is a free system installed by your pharmacy to help you independently access your prescription information. Talking prescription labels are critical to ensuring medication safety and independence. The ScriptTalk mobile app was designed with you in mind and is available for both iPhone and Android. The app takes advantage of accessibility features like TalkBack and VoiceOver. Today, we'll discuss the iOS version of the app, but rest assured, both are very similar in the way they are used. So, let's get started learning how to use the ScriptTalk mobile app. First, take a moment to download the mobile app from the App or Play Store and run through the registration. ScriptTalk uses a special electronic label placed on your medication container by your pharmacist. This special label uses RFID, or radio frequency identification, to relay the vital prescription label information to your ScriptTalk mobile app. Now, at the top of the ScriptTalk home screen, there are two options to access your label information: Full Scan and Quick Scan. Full Scan will read all the prescription label information out loud, including drug name, dosage, instructions, and more. This function will run through all the information on your label. Once you select Full Scan, find the RFID tag on the prescription package. It's a small, circular electronic tag that is typically placed on the bottom of the prescription bottle by your pharmacist. With your phone facing up, hold the prescription bottle facing down on the top of your iPhone screen. The bottom of the bottle will touch your screen. The iPhone will pick up the information in your electronic tag and read your label information out loud. You may have to move the bottle around a bit until the phone reads the information. Let's try one now, holding the medication over the top edge of the phone.
Patient name, John J. Smith. Medication, amoxicillin 250 mg capsule. Instructions, take 1 capsule 3 times daily.
Pretty neat, huh? The Quick Scan function, on the other hand, will read only the prescription name and dosage for quick and easy identification. You see, it will repeat the name until you remove the medication from the top of the device. Let's try it.
Amoxicillin 250 mg capsule.
That's all there is to it. Your vital prescription label information is available to you whenever you need it, wherever you need it. If you're using an Android phone, you will instead hold the bottom of the bottle to the back side of your cell phone, very close to where your camera is located. Simple, isn't it? Some additional features of the ScriptTalk mobile app include a My Meds button, a Pharmacies button, and a Help button. The My Meds button will pop up a list of all the medications you have scanned with the full scan mode. This list is particularly useful when you're at your doctor's office. The Pharmacies button provides a zip code lookup of all the pharmacies near you that offer accessible prescription labels.
Results. There are 8 scriptability pharmacies within 5 miles of 3, 4, 2, 2, 1.
Finally, the Help button offers a full overview of the ScriptTalk mobile app and its features.
The ScriptTalk mobile app is used to read ScriptTalk RFID prescription labels. Is your pharmacy a scriptability pharmacy? If not,
Thanks for taking the time to review the ScriptTalk mobile app. Remember, if you need assistance finding a pharmacy near you that offers ScriptTalk, please call Envision America at 1-800-890-1180 or visit www.envisionamerica.com.
All right, let me stop sharing and go back to the webinar here. So like the video said, you can use either or. You can use the machine that I demonstrated or the app. Of course, if you have an Android phone, you have to have TalkBack turned on your phone and it'll read everything in the app to you. And if you have an iPhone, you would use VoiceOver to read everything. I think I saw that there were some hands raised. Chris or Katie, do we want to go to those now if they might be about ScriptTalk while I'm talking about it?
Sure.
Okay.
We have Carolyn. You should be able to unmute.
Hi, Carolyn.
Oops, let's try that again. All right. There you
Carolyn,
are,
I
Carolyn.
think you're on mute. Yes, thank you.
Did you have a question, Carolyn?
I think I hit the button by mistake.
Whoops, that's okay. Well, hi,
no
Carolyn.
problem. Thank you so much. All right. I think we are good.
Okay, well, I'll just keep going. So one of the things mentioned in the video, one of the things I said, you do have to go to a participating pharmacy. So let me share my screen again, and we will go to the Envision America website, and I'll kind of show you what I mean. Let me make sure I have the correct website up here before I switch. Share screen. All right. So, you can just type in Envision America, but it's envisionamerica.com. And it tells you all about the company and the ScriptTalk. And the page that I'm on says, find a participating scriptability pharmacy. So you can either click the button that says automatically using my location, or I will enter my postal code. So I'm just going to click, I will enter my postal code, and I'm just going to put in 23227. And then I'm going to do submit. And it doesn't like my postal code. So let me try that again. I'll do a 10-mile radius. And then it says there are 17 scriptability pharmacies within 10 miles of 23227. So it'll list them. I'll give you the general overview. Walmart, every Walmart has ScriptTalk. So that one always comes up. So basically all that's coming up is a bunch of Walmarts. Rite Aid pharmacies also nationwide have the ScriptTalk. Publix pharmacies nationwide have the ScriptTalk. The VA, the Veterans Administration, has the ScriptTalk. Those are the big, like, nationwide brick and mortar pharmacies that have them. However, there are a ton of mail order pharmacies that has ScriptTalk. CVS mail order has it, not through the CVS store, but through their CVS mail order pharmacy. Most of the insurance mail order pharmacies like Humana, I'm trying to think of them off the top of my head. Aetna, any of the big insurance companies that they have you use a specific mail order pharmacy. I have not come across one yet that does not have it. So that's, let me see, All American Medical Pharmacy. There's a whole list. Caremark, which is the CVS pharmacy, Cigna Home Delivery Pharmacy, Credina Health, Eagle Pharmacy, Express Scripts, Home Scripts, Humana Pharmacy. So all of those, and there's just so many that have it that you really kind of would have to look up for your area. I'm only familiar with, where I live. So you can do that, or either you can call Envision America and they will walk you through the process of it. How you get it is, once you verify that your pharmacy participates with ScriptTalk, you just ask the pharmacist to sign you up. I will tell you, I have had issues through the years because this came out, I'm trying to remember the exact year. I think it was like 2014. And I've been doing this kind of work since 2015. So I started coming in kind of when it was kind of new. And I have had through the years difficulty getting clients signed up. What happens is maybe the pharmacy, like it's a big chain pharmacy, and corporate decided they're going to have this product, but somehow it didn't trickle down to the individual pharmacies, or there was staff turnover. So whoever knew about it is not there anymore. or they've never had anyone ask for it, so everyone forgot that they had it. So if you ask your pharmacy to sign you up after verifying with Envision America that they participate, what you would need to do is call Envision America and tell them about the difficulty you're having, and they will liaison between the pharmacy and you and help you get set up. And they're very good with that. I've had a lot of good luck calling Envision America. So just to let you know that, I'm going to stop sharing this and go back here. So that's pretty much it about the ScriptTalk. I will reference it a little bit more with some other pharmacies, but that's the main one that I love, just because it's pharmacist based and it's, you know, pretty accurate with everything that they do. Okay, so I had a question. If your script is with CVS, can you still ask Publix to print out ScriptTalk labels for you? You can, but I don't know if they'll do it. You can tell them you have the ScriptTalk. What happens is, kind of how this works is, the pharmacies that have ScriptTalk, they have to have this special computer printer and special software that they get from Envision America in order to make the labels. So if you use two different pharmacies and both of them have ScriptTalk, you can tell them you already have ScriptTalk, and they might print out the label for you. I've had a couple of people do that with success. So all you can do is ask, but if they don't have the equipment, they won't be able to do it. Like kind of Rite Aid, how Rite Aid has done it is they centralize their ScriptTalk labels. So what would happen is, if you had Rite Aid and you had ScriptTalk, they would mail your medicine to their Florida office, make the RFID stickers for the ScriptTalk machine, and then mail them back to your Rite Aid pharmacy. So Rite Aids probably wouldn't be able to do that, but I believe the Publix, all, if they participate, they all have their own printer. And also, can you get ScriptTalk for over-the-counter meds like Tylenol? No, this is only for prescription medications. So any prescription, it can be eye drops, it can be insulin, it can be a shot, it can be a pill. As long as it comes through the pharmacy, they will put a ScriptTalk label on it. Then it says, can CVS just request the stickers? And no, they cannot, because you have to pay for the service. So there's all of that behind the scenes. That's why you have to go to a pharmacy that already participates. So I'm going to get into CVS because they have kind of their own version of this. That's another reason they probably won't give you ScriptTalk labels. I'm not sure how this is affecting the CVS mail order pharmacy is under the same umbrella as the CVS brick and mortar pharmacies, but they're kind of their own entity. And so the CVS mail order is the company within CVS that had ScriptTalk, but now CVS brick and mortar pharmacies has developed their own accessible prescription reader. So I'm not sure if the mail order pharmacy is going to make you switch to theirs, or they're going to be two separate entities, because the CVS accessible prescription reader just came out. It launched in December. So it's so new that I'm not sure what's going on with it. But I'm going to tell you about the CVS one next. It is called Spoken RX. How it works is, let me go to their website and I will read it off for you. Let me share my screen again. Let me get to the correct one. All right, Spoken RX. So basically, CVS Pharmacy, it says, Spoken RX tells you which prescription you're holding and how to take it. All you need is a smart tagged prescription in our app. So this one works like the ScriptTalk app with the RFID sticker. So CVS says if you don't have a smartphone, they can send you a reader. And I have a feeling it's the ScriptTalk reader, but they don't mention that in their news release, so I'm not exactly sure. I haven't had anyone ask for the CVS reader. Everyone's just used their smartphone. So basically how the CVS Spoken RX works, this is also free. To sign up, you're supposed to just ask your pharmacist at CVS to sign you up. You have to download the app. So on the website, it tells you how to get the app. It says no extra charge, easy to use. You only need an iPhone or an Android smartphone, the smart tagged prescription, and their app. And then it says peace of mind. It gives you confidence and independence in understanding your prescription. So basically you go to the pharmacy section of of CVS app and tap the Spoken RX icon. When prompted, you hold your tagged prescription within 4 inches of the phone and it'll read the information to you. So I will tell you, the difficulty that I've had with this is kind of the same that I had with ScriptTalk when it first started. It's so new that not all pharmacies are aware that they actually provide this service. So I have had some difficulty, and I actually had to contact CVS corporate to find out how to handle it. So personally, they like assign me a liaison. So if I have a client that I'm trying to get hooked up and the CVS pharmacy says they don't know what we're talking about, I contact a liaison. I hope because of that, they've kind of worked out a process now. But the only thing I can tell you is if you're trying to do this on your own and your CVS pharmacy says they don't have it, ask to speak to the manager. And then if they are unaware of it, ask to speak to the disability spokesperson department. I mean, that's kind of who I had to go through, because every CVS pharmacy is supposed to provide this service. So if they don't, you kind of just have to advocate for yourself to get it done. So let me stop on that one. All right. Did we have someone that had a question that we needed to get to? I saw in the chat that someone raised their hand. I don't want to get too far off topic.
Let me get back there. 1 second.
Sorry, I think it's.
Yep, I got
Can't
it.
tell who it is. Okay.
Linda, you should be able to unmute and ask your question. All right, I think you need to unmute.
Raising hands does not like us tonight for some reason. We'll get to it. You know what? I think maybe I'll just wait to the end, and because it'll all coordinate together. So I'll just keep going until we figure this out. All right. So the next device that I wanted to talk about, the next pharmacy, is Walgreens. So Walgreens has something called the talking pill reminder. It works nothing like the CVS or the ScriptTalk does. They started it in 2014. I'm going to show you what it looks like here. So basically, you can find the device near the pharmacy. They usually have it hanging on a display outside the pharmacy. They sell these over the counter. Currently, they're about $10. But if you tell the pharmacy you have low vision or are blind, they are supposed to give it to you for free for every medication that you get filled at their pharmacy. It's called the Talking Pill Reminder. Basically what it is a white circular device, about a little bit bigger than like a dollar coin. It's about as thick as 1.5 finger widths. It has 2 buttons on it, and it has a display with a clock. If it's facing you and the 2 buttons are facing you, the button on the left is a timer that you can set as an alarm to remind you to take the medicine. So you can set it for 6 a.m. and 6 p.m. and it'll beep to remind you it's time to take that medicine. The button on the right is an audio button. That is the button that the pharmacist can record a message on. They have 30 seconds to record a message. And usually what they record is the name of the medicine, the strength of the medicine, and the medicine directions. I will tell you, I also have had a hard time getting this for free. However, I have a link. I don't have a handout for this webinar, but the vlog that is on the VisionAware website has links to everything that I'm talking about. And there is information on there. Walgreens has set up a customer service number because they coordinated this device with American Council for the Blind. I believe that's who it is. Correct me if I'm wrong. So they actually have set up a customer service number that's on the vlog. So if you have difficulties getting it for free, call that 800 number and tell them what's going on. But the other issue kind of that I have with this device is it's a little bit of a poor design because the speaker on it is on the underside of the device. So the top of the device has the display and the buttons. The underside is the part that you stick to the prescription, and that's where the speaker is. So basically you're sticking this device and you're muffling the speaker. I will show you. I'm going to play this. This is as loud as it goes. There's no volume control on it. And I'm going to see if you can actually hear what the recording says. Here it goes.
Metformin 1,000 milligram tablets. Take one tablet by mouth twice daily with meals.
Okay, so I could barely hear it. I have to like literally put it on my ear to hear it. And those clients that I have that are also hard of hearing, they don't have any luck hearing this at all. So that's the only thing that I don't like about this. It's hard to hear it. But if Walgreens is your pharmacy and you love Walgreens, ask them for the talking pill reminder. All right. The next thing I'm going to talk about, well, I have low-tech methods in here, but I'm going to kind of, I'll go over them real fast. So my favorite, the safest one for me, in my opinion, is the ScriptTalk and the Spoken RX, because they come from the pharmacist and they tell you everything you need to know about the medicine. I have gone to clients' homes that maybe they don't want to switch pharmacies. Maybe they use Farmer's Pharmacy and they've used that one for 20 years. And unfortunately, that pharmacy doesn't have any accessible ways of identifying medications, such as the audible ones or large print or braille labels. But that person does not want to switch because Mo has been their pharmacist for 20 years and that's what they want to do. So, those are a little difficult. So I had to do a lot of problem solving, but here are some things that I've used, in my work to help make the medication safer for them if they aren't able to get these accessible devices. One is the Pen Friend. So I'm not sure, let me see if I have mine. I do have mine. The Pen Friend is one. There's also a competitor to the Pen Friend called the Reason Talking Wand. This is a device that is used for labeling all sorts of things, but I kind of steal it when I'm in the home and use it to label their medicines while I'm in there. So the Pen Friend, unfortunately, this is not something that health insurance will pay for. So this would be an out-of-pocket expense, or if you work with your state's blindness services, they might provide this product for you. The Pen Friend costs about $120. The Reason Talking One costs about $70. That's why I tend to get the Reason Talking One, but I don't have one of those demo products. I just have the Pen Friend. So basically both of them work the same way. They both look and feel like a big fat pen. This one kind of looks like a microphone too. And that's what it is. It has a couple buttons on it and you turn it on and it will read labels for you. So they all come with labels, different sizes. And these labels have the ability to record information. I have never reached the limit. I think each one can save like 3 hours or something, but so it's really good that way. Let me get my labeled ones out here. All right, so what I usually do with this is I will place a sticker on the lid of the medicine. And I know this is really, really hard to see. So it's a little tiny sticker and you can kind of feel it because it's raised up. And I turn the device on. It's going to beep. And then you place the end of the Pen Friend or the Talking Wand to the sticker.
Metformin 1,000 milligram tabs. Take one tablet twice a day. Prescribed by Dr. Jones, 804-737-8596.
Okay, so basically that's me. I labeled the medicine. So to me, it's better than nothing. But the problem with this is when the person gets a refill, they're going to have to label their new medicines. So they will need visual assistance. So I tell people either take your bottles with you to the pharmacy, and as you pick up your refill, you ask that pharmacist what the medicine is, and you take the top from the old bottle and put it on the refill bottle, or you peel the sticker off and put it on the new one. So this is not foolproof. You need visual assistance when you get a refill, but to me, it's better than nothing, and it's another safety net. So that's that device. And I also did put in the vlog how you can get these devices if you want to buy them. There are specialty stores you can buy them from, but you can also get them online from like Amazon and places like that. All right, let me get myself together here. The next thing is a bottle magnifier. These, I can't find mine. All right, I have a picture of one. Basically what it does, it's a magnifier that's curved that will magnify the writing. You know, it's only good, they don't go up to very high magnification. The highest one I've seen, I think, is like 10x. So if you're able to use that magnification, then that will work for you. Or you can use your CCTV or a handheld magnifier or whatever kind of low vision devices you have to magnify that label. So that might work for you. Another thing you can do is use bump dots. So what I do with those is, of course, bump dots can't talk, so they don't tell you anything, but it does help with taking your medications at the right time. So what I usually do is organization is the key as well, whether you have vision or not. Keeping your medications organized is very important, especially if you're on a lot. So what I tend to do is I will get Ziploc bags and I will put all of the person's morning pills in one bag. And this person was low vision. So I was able to write AM on one of the bags and PM on the other bag, and they were able to see that large print. But another thing I did was, you know, we put all of their morning bottles in this bag, but also on the lid, I put one bump dot. So they knew that if they felt one bump dot, that was a medicine they took in the morning. The PM medications, put 2 bump dots on the lid. So that way they could feel and know, oh, it has 2 bump dots on it. That's a pill that I take in the evening. So like I said, this helps them know that they're taking the pill at the right time, but it doesn't help them identify their medications. So me being a nurse, I like safety, safety, safety. So I tend to do everything. I will organize into bags, bump dots, and get the ScriptTalk or an accessible reader. That way there is no question that they are taking the right medication. All right. And then there's also pill boxes. So there are pill boxes. This is, let me find my example. So this pill box is a large print pill box. I mean, geez, I think each box is like 2 inches by 1 inch. And it has Braille dots on it for the days of the week. This is, of course, just for 1 time a day. There are ones that you can get up to 4 times a day that have Braille dots and large print. And some of them, you know, you can get a contrasting color. Like if you see better with black print on a white background or white print on a black background, there's all different kinds of pill boxes you can get. These, unfortunately, are also something that health insurance doesn't pay for. So this would be an out-of-pocket expense, or your blindness services division through your state might be able to get it for you. So, you know, these are a good thing as well. Use your ScriptTalk to identify your medicine and fill your pill box. And then every morning you just verify. All pill boxes start on Sunday and end on Saturday. So, you know, if you start on the very far left, that's Sunday, and you can count the boxes over if you can't read the Braille dots. So that's just another tip. All right, let's see what I have next. All right, so the last kind of piece I want to talk about is a pharmacy. It is called Accessible Pharmacy. Let me share the screen so that I can show you their website. Let me get to the right page. Bear with me for a second, because I want to read from their website for you all. So Accessible Pharmacy, they started during the pandemic in 2020. I'm going to read kind of their description from their website. So it says, welcome. Accessible Pharmacy Services for the Blind is a comprehensive home delivery pharmacy service specializing in the needs of people who are blind, deaf-blind, and have low vision. We are the only provider of its kind and the largest blind-owned healthcare company in the country. What makes us unique is our ability to educate patients who are blind and their family members, healthcare providers, and caregivers to implement the best medication and diabetes management plan. Our goal is to achieve the best medical outcomes and help patients live more independently. Our pharmacy professionals are trained to understand the unique needs of people who are blind and have low vision. We offer both high-tech and no-tech solutions to assist with reminders, refills, error reduction, and overall medication and diabetes management. Our delivery, accessible support, accessible packaging, accessible labeling, including ScriptTalk and Braille, as well as continuous and automatic refilling are free. We do everything for you to make life simpler. We coordinate all details with your prescribers and insurance providers, including helping to keep costs as low as possible. Simply call us for a free consultation to determine if we are a good fit for you. We encourage our patients to be part of the ongoing process to maximize the solutions. In addition to prescription medication, we also supply vitamins and supplements, over-the-counter drugs, diabetic supplies, guide dog and pet medication, and small accessible medical equipment. And then there's a page that shows the people that started Accessible Pharmacy. One of the co-founders is vision impaired. He has retinitis pigmentosa, and they have a pharmacist who specializes in providing prescription medication and healthcare solutions to patients with disabilities. So I really cannot say enough about Accessible Pharmacy. I have helped many people sign up for their service, and you always get a person on the phone when you call. It's never an automated call. The process is very simple. I swear they don't pay me to advertise for them. I just think they're such a great resource that I tell everyone about them. Like I read, they were developed by blind people for blind people. So they are well aware of the needs of blind and low vision and deaf-blind patients. They service almost every health insurance plan. And like I said, it does not cost any extra. They just get paid what a pharmacy would get paid for filling prescriptions. They cannot currently fill in every state. So you would need to go to their website, and they have a list of what states they can prescribe in. I think they're only missing like 11 or 12. I haven't counted lately, but almost every state. They are out of Pennsylvania. So one of the issues kind of that comes up, you know, if you or your client or your loved one has Medicaid, which is the state health insurance plan, those plans vary state by state. And usually pharmacies from another state cannot fill prescriptions in a different state. However, Accessible Pharmacy has jumped through all the hoops. So the states that they are able to deliver prescriptions in, they can also bill most Medicaid plans. So if you have Medicaid, you would need to call them to find out if they can bill your Medicaid plan. So that's the only caveat that I have for them. You can call them. Let me see if I can give you the phone number real quick so you can put it in the chat, Chris. Let me get to the right page. It's also in the vlog if you want the information. Their phone number is 215-799-9900. So you can either call them, or you can go to their website and click on schedule phone consultation and leave your name and phone number, and they will call you back. Or you can use the Be My Eyes app. So if you're not familiar with Be My Eyes, it is a free app that you can download on Android and iPhones. And basically it is people that volunteer to be your eyes. So you would bring up the app, and it'll ring like a phone, and someone will answer, and they'll say, "Hi, how can I help you today?" And you can ask that person to describe anything. I mean, you can ask them to describe the clothes you're wearing, what color you're wearing, what is this food label? What does this say? What is this number? And they'll read anything to you. But a part of the Be My Eyes app is the specialized help section. So if you open up the specialized help section, under health, accessible pharmacy is listed there, and you can double tap on that to open it up, and it'll ring directly to accessible pharmacy, and you'll be on a video call. How that is helpful is if you use accessible pharmacy and for some reason you don't know what your medicine says, or you're diabetic and you have a machine and you can't see the number and you're using accessible pharmacy, you can ask them to read your label to you, or to explain the medicine to you, or to read your blood sugar number to you. That's just a service that they provide. You can also use it, you know, initially when you're starting, when you want to sign up, so that they can see your medication bottles if they have any questions. Sign up is super easy. Oh, it says who funds accessible pharmacy? They are their own entity. So they are self-funding. It is not any government program or anything. So to sign up, you would call them or sign up online or use the Be My Eyes app. You'll get a person on the phone and you just tell them, yeah, I'm thinking about switching to y'all for my pharmacy. And they'll just tell you all about them. You can ask them any questions you want. Really the only information they need to get from you is your name, your address, your phone number, and the current pharmacy or pharmacies that you're using. What they then do, they usually want to verify your insurance. They'll ask what kind of insurance that you have, and they'll verify that they can bill for them. And then they'll tell you, you know, we're going to call your pharmacies and get the process started, and we'll call you back. It usually takes a couple days. Of course, you know, sometimes there is a lag whenever you switch pharmacies, because the insurance companies will tell you when it's time for you to refill your prescription. So, you know, if you have a 30-day prescription and you are 2 weeks into it and you want to switch pharmacies, you have to wait till that 30 days is up before you can get a refill from the new pharmacy. That's for any pharmacy. So sometimes there is a lag time to getting your medicines, but, you know, once you get started and you're in, then you're good. Another thing that accessible pharmacy does is I call it kind of case managing in quotation marks, your medications. They stay on top of when you need a refill. They contact your prescriber when you need a refill. You know, you can call in whenever you want to and do that, but that's a service that they provide as well. So it really helps make sure that you don't run out of medications. There is a little bit of a lag time because it's a mail order pharmacy getting your medications. They usually, I have not had anyone go past 3 days that I'm aware of people that I know that use them, but it's usually 24, 48 hours. So, you know, if you happen to get, this is like with any mail order pharmacy though, you know, if you happen to get sick, say you get bronchitis and your doctor wants you to take an antibiotic and he wants you to start it today. So that might not be an appropriate medicine to get filled at a mail order pharmacy because you have to wait for them to fill it and then mail it to you. So that might be when you want to have a pharmacy, a brick and mortar pharmacy close to you that you're able to use as well. And you can do that, that's fine. You know, so you would get that prescription. That one might or might not have an accessible form on it to identify it, but you'll know the only one that you can identify with the accessible app is the one that you need to take now. So that's not really a big deal. It's just a little kind of bit of a hassle because you have more than one pharmacy. You know, it is always best to use one pharmacy. It helps the pharmacist know if you're going to have any drug interactions, easier to keep up on whether you're allergic to something, and it's easier for your doctors. Everything's coordinated. They can all know all the medicines that you're taking. So I do recommend that you always pick one pharmacy and then kind of have the backup pharmacy for any last minute or medications that you need quickly. I did want to say also about accessible pharmacy, they will do packaging for medications, and this is free as well, and they can explain these over the phone, but I have some demo products that they gave me to share. So one is, they don't call it the pill pack, wait a minute, they call this the individual daily packets, but if you've heard the commercials about the pill pack, it's basically the same thing. So basically what this is, let me get it straight because my fake medicine, which is candy, got askew from the box here. All right, so it is a thin cardboard box that stands up tall, and it has a slot on the top of it, and out of that slot are plastic bags that are perforated that have medication in them and a label. So this one is for a person that takes medicine 1 time a day. So basically there's 2 medications in here. Well, there's 3 pills, but it's 2 different medications. And this one has the person's name. Oh, 3 medications, the 3 medicines that they're on, and then the 3 pills are in this bag. So what you do is you tear it at the perforation, you open it up, and you take those pills, and that's your pills for the day. So it's kind of like a pill box that was filled for you. Now, these will not have ScriptTalk on them. So if you have low vision and you're able to read smaller print, this would be good for you. But this probably wouldn't work if you were completely blind and you wouldn't be able to identify your medication, because it might get complicated if you're only taking medicine 1 time a day. I guess it wouldn't be a big deal, because if you forget to take your medicine, you're not going to mess up and take medicine that you should have taken at night, because you're only taking medicine 1 time a day. So this might work, but if you're taking medicine more than 1 time a day, this probably wouldn't be the best choice for you, because if you forget to take your morning medicine and you're like, oh, I need to take my medicine, and then you go and you end up taking the AM medicine in the night and the night medicine in the day, it gets all messed up. So, but just so you know, that's one option. Another option is, these are called, let me look, these are called disposable pill organizers. So these are like pill boxes that the pharmacy sets up for you. These are good for everyone, whether you take pills once a day or multiple times a day. There are different ones. This is the single medicine one. Basically, it's a piece of cardboard that has these plastic bubbles in it. Inside the bubbles are the medications. You push the bubble, and on the back side, there's like a foil sheet, and the medicine pops out through the foil. So you're just going to go 1 bubble at a time, and that's your medicine. These start on the bottom right side, and it's 31 days. So this is a person that takes this 1 pill 1 time a day. So every day they're going to go to their bubble, they're going to push the pill out, take their medicine. The next day they're going to go to the next bubble, and so on. So this one, again, it doesn't have ScriptTalk on it, so you're not identifying the medicine, but it's already set up for you, and you know it's 1 time a day. The other one is for multiple medicines, multiple times a day. It's a little bit more complicated, but it goes the days of the week down. So the top row is Sunday, and then it goes all the way down to Saturday. This person takes pills 4 times a day. So you're just going to go across like you're reading a line of text. Sunday AM, noon, dinner, and PM, and they have filled your pill box for you essentially. So these are some of the tools that they have aside from the ScriptTalk. They also have braille labels and large print labels. They also do provide diabetic supplies. So if you need a talking blood glucose meter, Accessible Pharmacy has the Prodigy meters. You can get a doctor's order, and they can bill your insurance, and they mail it to you set up with strips. Or if you do not have insurance, or your insurance does not cover a talking meter, you can buy the talking meters through them for very, very cheap. If the prices have changed, I don't want to tell you wrong, but last time I checked, you could get the Prodigy auto code for $10, which is super cheap. And 50 strips were about $7 or $8 for 50 strips, which is like the cheapest you can find anything. So they will work with you on that. They also supply Dexcom, G6, and Freestyle Libre sensors and devices. So you can get those through them. They'll work with your insurance and your doctor to get them. And they also provide pet medicines. A lot of people had service dogs, and they wanted to be able to get their medicines from the same pharmacy. So they do that now. And you also can get some talking medical devices through them. Those usually are not covered by health insurance, but you can ask them if they are. Things like talking thermometers, talking blood pressure cuffs, things like that. I'm not exactly sure of everything that they have, but they have a few things. So that's them, Accessible Pharmacy. I think somebody asked, what is the bubble dispenser called? It is called, look, I can never remember, Disposable Pill Organizer. That's the bubble one that has the foil packets. So that's all I kind of had on that. Like I said, all of this information and links to everything that I talked about is on the vlog on VisionAware. I guess I'll open it up now to see if there are any general questions. I think I see one. Lindsay had a question in chat. Can you request a large print label at any pharmacy? You can. Not every pharmacy has them, but you're not going to know unless you ask. I believe Target has large print labels, and they'll also do like color coordinated things. Most of the pharmacies that have ScriptTalk, they also have large print labels and Braille labels. So just ask, all they can say is no. And, maybe it'll pique their interest and they'll get them if they don't have them. Any other questions? I guess Katie or Chris will open it up if there's anything in chat or raised hands or anything like that.
I just saw one come in.
Oh, yeah. Okay. So my mom has CCTV and has a hard time reading her med labels due to the shape of the bottle. Yes, that happens a lot. So, I recommend one of these accessible devices, or one thing you can do. Let me grab a bottle and see if it'll work for me. The stickers do not stick super sticky to medicine. So one thing you can do is you can peel off the edge of the label so it can be flat, and put a piece of paper behind it so it won't stick back to the bottle, and that way you can lay it and open it flat under the CCTV screen, and you might be able to read it that way. There are some readers that can read the curves, but it's a little iffy. Also, what is it? I can never remember. Not Be My Eyes. Well, I mean, you can ask Be My Eyes to do it. Some people they don't like other people knowing, reading medical information, which I completely understand, but it's not like you would ask them to read your medical history. If you want them to read a label for you, Be My Eyes could read the label for you. I am drawing a blank with the iPhone app that is
Seeing AI, maybe.
Seeing AI. Thank you. I don't know why I had a little brain
Too many
fart there,
acronyms,
but
right? Yeah.
yes. So Seeing AI, which is built into iPhones, you just have to download it if you haven't already downloaded it. You can use Seeing AI. And I had a client the other day that we tried it, and it actually was able to read the prescription label through the text section of Seeing AI. You kind of have to turn the bottle a little bit, but it gave her the name and she was able to identify it. So, just play around with things. I'll just wait a few more minutes to see if there's any other questions.
We do have Linda, your hand is raised, so I've
Okay.
given you permission to talk. You just need to unmute yourself.
Hi, Linda.
Can you guys
There you go? Yes, we
Great.
hear you.
Yes.
Okay, so I just wanted to go back. I just want to be sure that I heard you correctly when you were speaking about Spoken RX, and that was with CVS.
Correct.
And that's only utilized by an app, correct?
No, they market it as an app, but they also have a reader like the ScriptTalk. If you do not have a smartphone, you just have to ask them for it, and they'll have to mail it to you.
And now with the ScriptTalk, I'm not sure if I heard you correctly because I was having some technical issues. Is that provided through or offered through insurance?
It is provided through, yeah, I mean, it's free. So it doesn't go through your insurance. Kind of how it works is it is a service that pharmacies sign up to provide to their customers. So you have to go to a pharmacy that has signed up to provide ScriptTalk. But it's free through that pharmacy. I'll just use Walmart as an option because Walmart has ScriptTalk at every Walmart in the nation. You would just ask your pharmacist when you get prescriptions filled, I want to sign up for ScriptTalk because I have low vision or I'm legally blind or whatever it is, and they will sign you up for it. What happens is you have to wait to get the speaker box mailed to you, which takes about 2 weeks. And then you have to wait when you get a refill for Walmart to put the RFID stickers on your medicine that the speaker box reads, and then you're set. Walmart puts you in their system as a ScriptTalk person, and every prescription you get through Walmart from then out should have the label on it. Or you can use the ScriptTalk app, which you just download from Google or Apple, and it works the same way as the machine. Did that clarify your question?
Yes, it did. Thank you so much.
Okay, so to find out if a pharmacy participates with ScriptTalk, you need to go to envisionamerica.com and put in your zip code or the name of the pharmacy, and they list on there who participates with them. And like I said, if you find a pharmacy that participates with ScriptTalk and you ask the pharmacy to sign you up for ScriptTalk and they don't know what you're talking about, or they're having a hard time figuring it out, contact Envision America. They have an 800 number on their website, and tell them what the problem is, and they will work it out with the pharmacy.
I think we had a couple of comments in chat, perhaps.
Okay.
I heard come through.
I think one was Chris putting up information about the Connect calendar. And
Yes.
someone put the Android option, like Seeing AI, is called Google Lookout. So thank you for
Yes.
that. That was Kelly that gave us that information. Thank you. And then Linda put, presentation is much needed and well done. I appreciate your style. Thank you very much, Linda. I think that's all I have. So I'm going to take that as I did a good job explaining everything. So like I said, there's more information on the website with links to everything. And hopefully no one has any problems getting these devices. They are all free. So don't let anyone try to charge you for them. Okay. They're free. So thank you all very much. And everyone take care and stay safe in this climate that we're having, and look out for snow. I think I'm getting snowstorm tomorrow, so we'll see.
Oh dear. Well,
Thank you all so much.
Thank you, Kim. But before everyone runs away, I want to make sure that we give the closing code for the webinar today. And give me 1 second. I'm having some issues here. All right. Are we still good? Can everyone hear me?
Yes, can hear you.
Okay. All right. Let me pause the recording and give our closing credit, our closing code. So with that, Kim, again, thank you so much for your time and sharing your knowledge with us. And we just really appreciate your time and all the resources that you had to share with us this evening. It's always a pleasure to find and learn about free resources for managing something so important as medication.
Thank you. It was my pleasure. Y'all take care.
All right. Thank you, everyone, for attending, and have a great evening. Stay safe and well.